Hello, my friends, and welcome back to the Reflux Revolution podcast. I'm Molly Pelletier, registered dietitian, leader in nutrition for Reflux GERD and LPR, and the founder of Flora Nutrition. I started this podcast because I have been where you are. After years of struggling with reflux symptoms and feeling overwhelmed by conflicting advice, I made it my mission to help you find real, long-lasting relief. In this podcast, we are cutting through the noise, providing practical, evidence-based strategies, and giving you the tools to manage your reflux with confidence. In today's episode, we have a very special guest, Dr. Mukta Chauhan, who is one of the few PTs in the country who is double board certified in orthopedics and women's health. She understands the delicate interplay between neurophysiology, biomechanics, musculoskeletal, fascial organ systems, all of these things that really make a massive impact in our digestive system. She's a firm believer in addressing health from a biopsychosocial perspective because we are not just tissues. In today's episode, we're going to be discussing the connection between our pelvic floor and our digestion. When it comes to constipation and reflux, the pelvic floor plays a really important role. Our diaphragm also plays a very important role, and Dr. Mukta is going to break it all down for us for what we need to know about our pelvic floor to help prevent constipation and reflux, and how understanding this connection between our pelvic health and our digestive health can help us optimize our gut health and prevent reflux. Before we dive in, the information shared in the Reflux Revolution podcast is intended for educational and informational purposes only. It is not meant to diagnose, treat, or cure any medical condition, and it should not replace personalized medical advice from your physician or individualized medical nutrition therapy from a registered dietitian. Always consult with your healthcare team before making any changes to your health routine. Your body is unique, and your care should be too. So let's dive into the episode. Dr. Mukta, we are so excited to have you here. Can you start by telling us a little bit about your background and what led you to specialize in both orthopedics and women's health?
I'm so happy to be here as well. It's one of my favorite topics. Let's dive in. I didn't decide to specialize in both. I think it's just the path how pelvic PTs mostly kind of specialize in pelvic physical therapy. They always start from orthopedics, and that's how I started my career as well. And I was working in an outpatient setting where, the reason why I decided to go the pelvic route was I was working with a woman and I was treating her hip pain, and we tried all kinds of different things, exercises, manipulation and whatnot. And then something was not clicking. Her pain would improve, but then it would come back. And I was kind of like, I think pelvic PT was just becoming a little popular around that time. And we were kind of encouraged to ask questions about people's sexuality or other bladder and bowel issues. So I just generically asked her, I was like, hey, are you having any other issues related to your bladder, bowel, or sexual dysfunction? And she's like, she was a physician assistant herself. She's like, interesting you asked me that. I actually do have bladder leakage and pain with sex. And I was like, okay, tell me more. And then I actually just ended up sending her to a pelvic PT. And she later wrote to me that her hip pain was a lot better. So that made me made me curious. And I was like, I want to learn this piece of the puzzle, which is kind of like sits in between the hips. And I don't know how to work with this. So I did my training, I did my board certification, and I just loved the field so much. So whenever we are working in pelvic health, we are still treating people orthopedically. And majority of the times the pelvic region is so it doesn't work in isolation. So it's not like you're just with a tunnel vision, just working there. We are working with the hips, we're working with the spine, we're working with breathing, rib cage. We work with the digestion, which I kind of brought into my specialty as I kept working in the pelvic world. It's kind of like a very holistic work. So I wanted to maintain my orthopedic board certification as well, because it just helps me integrate the understanding of the whole body so well. So yeah, that's my little story, little background.
I love the whole body approach. Yeah, it's
Yeah.
amazing. So speaking of that, so a lot of our listeners, I think, when they think about the pelvic floor, they're thinking like bladder, postpartum. Can you talk about like how the pelvic floor plays a role in digestion, gut health?
Absolutely. And it's one of the most, or I would say least understood thing. People think pelvic floor related issues only happen in women and after birth, or maybe at older age when the muscles become weak. And this is a question that I get most very commonly. Mostly my patients ask, my problem is not related to leaking or like, but do you have any experience with tense pelvic floor? And I would say 90% of my clients have the tension in the pelvic floor issue a lot more than just a pure weakness issue. And this is something which people get confused about a lot. They think a tight muscle or a tense muscle is a good thing because it must be strong. But in order for a muscle to work optimally or efficiently, it needs to have an optimum length. When it loses that optimum length, whether it's too loose and weak or whether it's too tense and tight, it is not going to be able to generate enough force. And then we start to see all kinds of different issues. And what are these issues that commonly we see with pelvic floor dysfunction? Since the pelvic floor is, I'm just showing a model of the pelvis with the connected pelvic floor. Pelvic floor actually supports these pelvic organs that sit on top of it. The uterus just fell. 1 second. So in females, it supports the bladder, which sits right behind the pubic bone, the uterus and the fallopian tubes that sits right behind the bladder, and the rectum that sits right behind that in front of the sacrum bone, which is the bone which connects the back part of the two pelvic bones. But the pelvic floor's function is not just the supporting of the pelvic organs. It has a sphincteric action, which is the most commonly known function, which is basically it closes and opens the urethra, it closes and opens the vaginal opening, it closes and opens the anal opening, and closes and open basically the penile, the urethra that goes through the penis as well. So it's not just doing that function only in women or people who identify as females, but it's also, if pelvic floor is a muscle in men also, which people don't really think that it affects men too. So that's a sphincteric action. The pelvic floor, since it's a muscle that sits inside the pelvis like a trampoline, it has a function of lifting and how do I explain this? Expanding and lifting. So it kind of really works like a trampoline supporting these organs. But this trampoline-like action, this closing, contracting, and expansion also helps bring the lymph and the blood back to the upper part of the body. So it helps in circulation also. Pelvic floor also works with the diaphragm, which is the primary muscle for breathing. And this is where the digestion comes into the picture. The pelvic floor works in a synchronous manner with the diaphragm. It helps in breathing, postural stability, and digestion as well. So pelvic floor's function in digestion is not just because the rectum goes through it and it's kind of keeping things closed so we don't soil ourselves. That's one of the functions that people are familiar with. But because of this back and forth contraction and expansion, which happens in coordination with the diaphragm, it aids in digestion as well. So we'll go into a little bit of detail of the digestion process. What is this synchronous motion actually is? So people who can't really see the video, just imagine that diaphragm sits inside the rib cage. Let me see if I can find a skeleton for people who can see. So the diaphragm sits inside the rib cage like a dome-shaped muscle. And it is connected to the ribs also, by the way. It gets inserted to the lumbar spine, and its motion is basically as we inhale, it contracts and goes into the abdominal cavity. So it expands and lowers. And then as we exhale, it comes back into the thoracic cavity, goes back to its original position. So as we are inhaling, the diaphragm needs to move down. So it kind of creates more space for the lungs to take in the air. And it goes back up to pushes the air out of the lungs. So that's their primary function. But just imagine the pelvic floor sitting in the opposite direction, like a trampoline. So we have a dome-shaped structure above and a trampoline-like structure below. So when the diaphragm, when we are inhaling, the diaphragm kind of goes down into the abdominal cavity. It displaces the organs that are in the abdomen. And that's why we see that abdominal distension when we are inhaling. It's not because our lungs are in the belly. Obviously not. It's because of the distension, because the diaphragm goes into the abdominal cavity, it lowers down, pushes these organs, and these organs need to go somewhere as well because the pressure is increased in the abdominal cavity. So the pelvic floor then expands downward to accommodate that pressure that's increasing right above it. So this is kind of the mechanism that happens with inhale. When we are exhaling, the diaphragm relaxes and goes back to its previous position, its resting position, which is the thoracic cavity, which is like inside the ribs again. The abdominal organs kind of go back to their original position as well, and the pelvic floor comes back to its original position inside the pelvis too. So this is like this back and forth motion is coordinated of both abdominal muscles, diaphragm, and the pelvic floor. And now you can imagine if we are breathing, like let's say an average person breathes 12 to 15 times a minute, that's our respiratory rate. You can just multiply it and see like how many times that the diaphragm kind of moves in a day. And if it's moving that many times with this kind of a very rhythmic motion, it's almost like feels like massage over these organs, because guess what sits right under the diaphragm? It is your stomach on the left side, your liver on the right side, and then your intestines and your colon, all of it. The transverse colon sits right under the diaphragm. And obviously everything else is under it. It doesn't need to be in direct touch, but it can still have a really big influence because of its continuous movement, up and down movements that it does. Let's say if for any reason you have a tightness in your pelvic floor muscles, it is going to impact your breathing. Sometimes it's kind of like such a nicely coordinated system, integrated system, that you can't always say that breathing is what's affecting the pelvic floor. Pelvic floor can also affect the breathing. It kind of goes both directions. So if there is tension in your hips, tension in your pelvic floor muscles, and your pelvis is all kind of stuck and stiff in place, we always notice this in those patients of mine. They also have difficulty breathing because it's just kind of like a chain reaction that's coming from the lower part of the body that goes up, and you feel like the breathing is very shallow for these people. We can see a bottom top down effect of these things as well. Let's say if someone is very tense in their shoulder muscles, or they just, to begin with, they have a very shallow breath, they're not going to have this nice up and down motion of the diaphragm, which impacts the pelvic floor, and people can have pelvic floor dysfunction as a result. So it kind of like can affect from either direction. Another direction where it can get affected, which is the third factor, which I originally said, abdominal muscles. If the abdominal muscles are always kept in tension, because Think of this as, actually, let me rephrase it and explain it as a soda can. This is a pelvic, this is a model that a researcher named Mary Massery came up with. And she talks about the trunk as a soda can. The top of the soda can is your diaphragm. The bottom of it is the pelvic floor. And the sides are the abdominal muscles. So if you kind of try to squeeze the soda can by tensing the abdominal muscles, the pressure will be going to the pelvic floor or up towards the abdominal muscles, which is basically the reflux can happen because of that. But if there is like a little bit of release we create by opening, popping the soda can, there could be a nice management of the pressure that can happen. There are so many different interpretations of this soda can model, by the way, but just to kind of keep things simple, I'm not going into too much detail. But the idea is that the top, the bottom, and the walls all affect the pressure in our system. So we have to be mindful of all three. We cannot be like, okay, let's just breathe and everything is going to be okay. We have to check whether you're holding tension in your abdominals and pelvic floor. So any of the three components of the system can affect the pressure building in the abdomen. So this is one way of discussing the role of pelvic floor in the digestion, the puzzle of digestion. But yes, very, I'm willing to speak about some specific things if you have questions about.
Yeah, I mean, there's so many themes in what you just said that are themes we talk so much about on the Flora app. Like, I've been really open about my journey with pelvic floor. I am one of those people who tend to have that really tense, tight pelvic floor. And it's something that I have to continue to work on because that can impact constipation. And then constipation impacts gastric pressure. Tight muscles also impact gastric pressure. All of these things, anything that impacts gastric pressure can contribute to reflux.
Absolutely.
So
Absolutely.
it's really fascinating.
Yeah, like what you said, like it just reminded me that I didn't speak about I've been talking about the pelvic floor tightness, but why does it impact the whole gastric pressure? In some ways, because of pressure, it's almost like you just stopped that weight, the even weight distribution downward. So obviously there would be a little bit pressure, maybe distension, bloating kind of sensation, or it could even go back up. So the pressure needs to go somewhere. There needs to be some release somewhere. So if there is any part of these three pieces is affected, the pressure build up can affect the digestion or reflux or constipation. In other ways, we didn't talk about the outlet obstruction, which is another piece of the puzzle when we talk about constipation. Constipation, yes, fiber, water, food, digestion overall. So many things can impact constipation. But the pelvic floor also supports the rectum and also makes sure that leakage doesn't happen. But what happens when it's just doing the job a little too much? Like when it's really gripping around the rectum, not letting it open. This is what we call the dyssynergic constipation or outlet obstruction, which prevents our ability to just, open up in a relaxed way and let the rectum do its job. Because the rectum has a peristalsis that can push things forward. But if the door is jammed, if the door is blocked, it doesn't let that opening happen, then things just don't move in a very smooth way. And then you will be creating more pressure. People strain in order to go. By the way, straining actually may feel intuitive in order to push things forward, but straining while holding breath, which is again creating a lot of pressure in the abdomen, can create more tension in the pelvic floor. So yeah, it's just like, okay, so what do we do? Like not strain and just keep sitting. It's like, these are the questions that my patients ask me quite commonly. But yes, like that gripping of the pelvic floor can affect constipation also, and then create this back pressure in the GI tract.
For sure. So yeah, so you mentioned avoiding straining, avoiding holding your breath while going to the bathroom. What are some things we should be doing to help that flow and healthy evacuation process?
So a bunch of things, first of all, like, having a good breathing, some kind of exercise to make sure you're not staying in that either shallow breathing process or tensing your abdominal muscles too much or tensing your pelvic floor muscles too much. Gripping or holding patterns are always going to affect the overall digestion or our ability to go, because ability to go is that letting go, that clenching or holding prevents us from doing. So we have to really be able to release the tension in these muscles. But in talking about that specific mechanism of pooping, straining is not very effective as it ends up closing or increasing the tension in the pelvic floor even more so. So rather than straining by holding the breath, there are some other ways of creating enough pressure to push things forward without closing the door of the pelvic floor. And these things are, using a squatty potty because it puts your hips in a certain position to put the pelvic floor muscles in a relaxed position. Then if you could do more of a grunting or moaning kind of an exhale, which we also teach for birth as well, by the way. Kind of similar mechanism, pooping and birthing, kind of, not silly, but kind of. Sorry if people got disgusted by that, but I think
No, we
it's
talk about
fun,
everything on this. There's
Yeah.
no such thing as TMI on this podcast.
Absolutely not. No, definitely not talking about TMI. But some people are like, no, don't prepare practical pooping. But yeah, sometimes it helps to understand the mechanism like that. So if you are kind of exhaling with, funnily enough, I talk about mooing because moo is a very deep kind of a moan or kind of hitting those low notes. So by saying like a moo, a deep moo, you create enough pressure at the top of your abdominal muscles, but no pressure in the lower abs, which helps the pelvic floor muscles stay open so you don't create that tension. So the rectum, the end of the rectum, the anal sphincter open up when we create this kind of a moo sound, but there is enough pressure in the system to propel things forward. So that's what we are looking for, not to close down or clamp down at the very end. So that's one thing we teach in my office, or people can just try to do that. And you could try right now, like, just close your glottis, take a deep breath and like strain. And you'll feel like, oh my God, like that is a little too much. But to control that pressure, think of mooing. If anybody has ever cooked in a pressure cooker, it's like you're letting that valve open a little. So you're releasing the pressure this way up through your throat. So all the pressure doesn't go down. So it's kind of like a pressure management technique to say moo, or like people can grunt, like these kind of things are way more helpful than doing like a clamped down, holding the breath string.
Yeah. So in everyone listening, like I have tried this. My clients have tried the moo breath. Don't knock it till you try it. If you struggle with constipation, the moo breath it can really help. But also if you're in like a scenario, maybe an apartment where you can't be making noise, can you talk a little bit about diaphragmatic breathing? I would love to hear you talk about this because on the Flora app, we talk so much about diaphragmatic breathing because the diaphragm is part of your lower esophageal junction. Like it is part of what helps create that anti-reflux barrier. And we use diaphragmatic breathing post-meal for lower esophageal sphincter health. We use it pre-meal for nervous system support. But like, can you talk a little bit about diaphragmatic breath for maybe constipation or pelvic floor?
Oh yeah, like diaphragm, it's just like, I think one of the most favorite muscles of mine, sometimes even more than the pelvic floor. Yeah, like I think you said a bunch of things which are absolutely perfect. Like, diaphragm kind of activates your vagus nerve, which is part of the parasympathetic nervous system, which can already put you in that rest and digest state. So you will do a better job of digesting the food. Pooping is also a parasympathetic nervous system. So if you're rushing in the morning to catch the bus or the train or get to the office to be in the first meeting, you will always have that difficulty because guess what? When we are in a flight or fight, these bowel movement, bladder, these things are not important for our nervous system to take care of. So things just shut down. So no matter how well you are eating or how well you digested, if you are in that sympathetic state, even going to the bathroom is going to be difficult for you in the morning. So yeah, breathing can be that nice entryway to support your parasympathetic nervous system. Parasympathetic nervous system is one of the two branches of your autonomic nervous system. And as the name suggests, it works autonomically. It is automatic. You're not constantly thinking, oh, let me adjust my heart rate, or let me adjust my breath rate, or let me adjust my digestion. These are things that happen at an autonomic level. However, breathing is one of those entry level into this automatic system, kind of like a backdoor entry through which we can control and adjust our state from a sympathetic to a more parasympathetic driven, which helps in all of these different functions, digestion and going to the bathroom. So that's one of the ways the diaphragmatic breathing helps. And then another is more mechanical way. If the diaphragm is doing its up and down motion really well, there's going to be a continuous massage. The pressure is going to be managed in a much more gentler and efficient way. The pelvic floor's motion is going to be well controlled and well coordinated if the diaphragm is working well. So diaphragmatic breath works in so many different ways. I can't even go, I can keep going on and just talk about it. So the diaphragmatic breathing, this is something I want to talk about. And this is another major confusion about diaphragmatic breathing, because people think that diaphragmatic breathing is all just belly breathing, which you can just go in and out. It's one of the easiest way to connect to your parasympathetic nervous system, because when you're thinking about belly breathing in a nice shavasana, or like when you're completely relaxed, that is the part that moves. So bringing your awareness to your belly, or rather going into the shoulders or neck area, is not wrong. It's perfectly fine. But the problem comes when we are just so focused on belly breathing, that we are so focused on distending the belly, that we forget that diaphragm is a dome-shaped muscle, which impacts the back side of the body as well as the front side. So it's not frontal plane muscle, meaning it's not in my stomach, it's not on my stomach, that this forward and back motion is going to be the best way to make it work. Diaphragm is a muscle that attaches to the entire rib cage. And actually, if I can show a really cool, you can probably cut this part. I'll show this on this app and see if it's visible. So you can see that the diaphragm is a pretty massive muscle which sits inside the rib cage, and it goes all the way back as well and connects to the lumbar spine. So if we are just focusing on this front position, for front distending and like lower rise and fall of the belly, as we talk about, we're not going to be working on this back part of the ribs or back part of the diaphragm. And that is why the pressure doesn't distribute evenly in our trunk. So it is very important when I teach diaphragmatic breathing, we call it 360-degree breath. My balloon deflated, but I think good enough. So we want the diaphragm, which kind of sits up like all around. We want the breath to kind of spread out sideways, front and back, all in a 360-degree manner, rather than just going up and down here. And for that, you also have to make sure not to complicate this too much, but since the diaphragm attaches to the rib cage, doing some rib cage mobility, like threading the needle movement or some rotational exercises where the ribs kind of expand and they are mobile as well, that will really facilitate that 360-degree breath. So in order to simplify things, I would just ask everyone to put their hands on the lower rib cage on the sides, and just think about that you're breathing into your hands rather than into the belly. So take an inhale there, and then as you exhale, feel the rib cage kind of coming back together towards the midline. And then take another inhale, and you'll feel the hands kind of lifting sideways and then coming back in together. And you will see that there is a little bit of belly movement happening even with this, but it's a more balanced way of breathing because you might feel a little expansion in the back part also. So I always start with the sides, and then I have them put one hand in the back and one hand in the upper belly, and have them feel this expansion happening front and back also. So this 360-degree breath is something which I really spend a lot of time on, generally speaking, when I'm doing diaphragmatic breathing. Let me think if there is anything else.
Yeah.
Yeah.
I love how you described that parasympathetic nervous system response, because we see this with so many of our clients. They'll come to us and be like, I'm doing everything right. I'm eating all the right foods and I'm taking all the supplements and doing everything. And it's like, but you're still living in a state of sympathetic nervous system. Like you're living in a state of fight or flight. And when we are living in that state, like you said, certain things shut down, certain things are deprioritized. One of those things is also digestion. So like 99% of our clients, like they either already know or they find out through working with us that stress is one of the drivers of their reflux symptoms. And so there's so many physiological reasons why that is. The diaphragm or esophageal sphincter, incomplete bowel movements. There's a million reasons I could go on and on, but it's so cool to hear you talk about it from that perspective. And we love diaphragmatic breathing. And I love how you described it as that backdoor entry into your parasympathetic nervous system side, your rest and digest response. And it's free. It's free for people to start doing this. And it's so, so powerful. So I love how you mentioned, movement too, like rotation. Oh, I've never even thought about that, like opening up the intercostal muscles to be able to take about a deeper breath. And I'd love to kind of wrap everything up is to hear from you, like what role can we take as these listeners moving on in their reflux relief journey? Like what sort of movement should we think about prioritizing? Because so many of our clients also, they stop moving when they get reflux because they get nervous. And so
absolutely.
So like that could be contributing to the problem. So like what sort of movements should we incorporate and be thinking about?
This is such an important point and such a great point you just made. And it just like, I suffered from reflux a lot during my pregnancy. Like that was my only symptom. And it kind of like, it would just not go away. It made it very difficult to eat anything. And I mean, in my pregnancy especially because the intra-abdominal pressure increases so much and it was not in my control. And then there is a little bit of, we don't even have to go into the detail of so much, like I have hypermobility and people who have EDS and those, like, they just don't have that potent sphincter that closes very well for them.
Yep.
So they're always at a risk of the reflux because nothing closes down there, or they don't have that, ligamentous strength or tensegrity, that's what we call, to keep things closed. So we have to heavily rely on the muscles and strengthening of these muscles. But in general, like just to think about that time when I was having so much reflux, my body just wants to recoil and be in this position in a protective place. And it was so hard for me to just even open up here when I was having that difficulty. And I'm pretty sure a lot of people would relate to this. So imagine if your pain or difficulty, discomfort is making you recoil and tensing up in a specific way, how is it going to affect your breathing? If you're in this position, just kind of curl in and try to breathe. It's going to be impossible for you to take a diaphragmatic breath. It's just going to be impossible. So it's kind of like a vicious cycle of that discomfort affecting your breathing. You need a strong diaphragmatic response to close it. So you're just kind of like you're stuck in that. So gentle movements to begin with, if you're in the flare, especially, can go so long. It can really restore your diaphragmatic breathing. And also, like, gentle movement is always it's also kind of reducing the threat level of the nervous system also. So again, taking you towards that parasympathetic, maybe not quiet because you're still struggling with it, but it would probably readjust or dial down things enough for you to start exploring other things, even with less hypervigilance. Because, we try to dissect the physiology or neurophysiology of the body, like, no, let's just work on this. But things work together. How do you not work on? And it's some of my clients say, let me just first fix my constipation and then I will work on the stress. Yeah, you can't do that. And I get it. Like, it might probably make things simpler or less overwhelming, but sometimes you have to do just a little. They're like multiple dials. You have to work on them simultaneously, and then things will start coming together for you, for sure. So gentle movements, like if you're like difficulty walking or something, like if you're sitting on a chair and working, which a lot of us have the sedentary job, just kind of rotating and stretching your rib cage can begin that motion back to your spine and rib cage. It's like, oh, and what happens if you just, take a towel, make a tight towel roll, put it across the mid spine, and just kind of lie down with open arms. Whatever, like, you can reduce the thickness of the towel as well, just to see whatever feels safe to your nervous system to do, just to start opening this front part, not be so clenched. And then slowly work on breathing in that position. One of my favorite positions for breathing, where you're like, okay, this is too complex for me, I can't really feel into what part of my rib cage is moving or not, is this little inclined position where your feet are up on a sofa, your upper body is on the floor. You could put a couple of pillows under your pelvis, so you're kind of like at an incline, and because it's almost like we are trying to get to that. What do you call it in yoga? The inverse, not inverse.
Inversion?
Inversion, yes. So you're kind of like going into inversion, but at 45 degrees. So very, very, very mild inversion you are getting to. And because the gravity kind of pulls the abdominal organs towards the diaphragm, it kind of gives a better proprioception to work in that position. So just because of the position, you may feel like all of a sudden that you couldn't sense into your diaphragm, that starts to work automatically. So that's one of the exercise or positions I ask my patients to go in. But it could be challenging if someone has reflux because they don't want to be in that inversion position. So people who have that, maybe don't try. People who have constipation can definitely try that position.
Or on
and
an
just
empty
see.
stomach. If they're on an empty stomach, they can.
Or whenever you're not feeling the flare, and just to kind of access your diaphragm, you could get into that 45-degree inversion position and just see the magic happen. It usually works for majority of people.
Amazing. Amazing. And then also the tightness of the pelvic floor muscles. Like, are there certain stretches like pigeon or certain things? Because we have on the Flora app, we have gentle yoga, we have pelvic floor yoga, different neck and shoulders yoga. all of these things. But do you have any favorite movement poses or things that you would suggest for the pelvic floor?
A lot of hip mobility, I think, is something which I always encourage my clients. Pigeon is one of those positions where it's just very commonly known. But there are other positions. One of the easy ones, because again, like I always start with gentle movements which feel less threatening to the system and which you don't feel like, oh, am I doing it right? Or like, what position? And it is the windshield wiper, because it's a very rhythmic motion. You're going back and forth and you're accessing not just the external rotation, which is in the pigeon pose, but also internal rotation of the hip, which opens and closes the pelvis on one side and the other. So this kind of an open and closing alternate motion that happens on both sides can really help mobilize the pelvic floor because it connects to the inside of the pelvis. So that's one of my most favorite positions. But happy baby, like yoga is incredible for pelvic floor, for your whole body, to be honest. But yeah, could be very important and helpful to do those movements for sure.
Yeah, we love helping our clients add those into their daily routine just to support the nervous system, but also the pelvic floor. And it can be a great way to kind of unwind from the day and shift
Absolutely.
into the
Yeah. For sure.
Awesome.
Yeah.
Well, thank you so much, Dr. Mukta. This was so helpful. It's always a pleasure to speak with you. And where can people connect with you, learn more about your work?
So not as active as anymore on Instagram, but I have a lot of content, especially if people are interested in like, oh, let me figure out how different breathing positions can be accessed. There are highlights on my Instagram. So check out I've even forgotten my own handle, the pelvic.connection. So that's my Instagram. Just like people want to work with me. I work in New York City, in Manhattan, in person. I sometimes do these virtual consults as well, but I always like to work with people in person. So anybody is in New York and want to see or work with me, they're most welcome. I'm on the Upper West Side. So yeah, that's where people can find me, Instagram or in person.
I will link that down below, but thank you
Thank
so
you.
much. This was such a great conversation. I really appreciate it.
Thank you for having this conversation. It is just amazing to work with different professionals and like connect these dots and like, hey, it's been such a life-changing experience for myself because I had such a limited understanding of how diet works. And like now I just don't even give any of those uh, advices to my patients, like just go work with a dietitian, it's going to be so wonderful. And I think when they do that, they really see the difference. So thank you for what you do as well.
Oh, thank you. Yes, I absolutely love what you said about the dials. Like we have to sometimes tweak multiple things like diet, also nervous system at the same time.
Absolutely.
To see results. So totally, it takes a team for sure. Yeah.
Yep.
Well, thank you again. It was great to see you.
Thank you.
All right, my friends, I hope you enjoyed this discussion as much as I did. It truly is such a powerful topic for anyone struggling with constipation or reflux. These are key principles to absorb and implement into your routine. So if you liked this episode, share with a friend who may benefit from it. Be sure to subscribe and leave us a review. This really helps the podcast reach more people that may benefit from it. Send me a message on Instagram. Let me know what you want to see on the podcast. And thank you for being a part of the Flora community. I'll see you in the next episode.